Have you ever wondered what a gastroenterologist does all day? We went to Google to see your top questions about the many things that a gastroenterologist does. Let's see what we've got. What do gastroenterologists treat? Guts and butts, and so much more. Gastroenterologists manage conditions that affect your digestive tract from your mouth to your anus, and other abdominal organs in between, like the liver, the pancreas, and the gallbladder. When to visit a gastroenterologist? Well, come on over, neighbor, anytime. The most common reason that you're going to visit a gastroenterologist is to have a screening colonoscopy. But if you're having a problem with your GI tract, you probably will start with your primary care doctor. But if that abdominal pain or other symptom persists, then it's time to come and visit us. Also, if you have an alarming symptom, like you're vomiting blood, or you're losing weight and having persistent diarrhea, then these are all reasons to visit a gastroenterologist. If these symptoms are severe and the clinic is booked, then you may need to go to the ER to be evaluated to see if you need to be hospitalized. And if you do need to be hospitalized, guess who you're going to meet? A gastroenterologist. What will a gastroenterologist do on the first visit? Are you worried that we're going to stick a finger up your butt and a scope down your throat? Don't be worried. A gastroenterology visit is really just like any other doctor clinic visit. We're going to perform a history and a physical, and that's going to focus on your GI symptoms. GI symptoms can extend into systemic symptoms, so we're going to be asking other questions, and they may not seem like they're that important, but they want to get to the heart of the matter that's bothering you. In the end, at your first office visit, you will not have any endoscopic procedure, but these may be planned along with labs or imaging. And if I really need to do a rectal exam, I'm probably going to save it for the time of your colonoscopy. That way, we only have to drop your pants once. Can a gastroenterologist diagnose a hernia? Yes, and there are many types of hernias which we diagnose. We can diagnose hernias that are around your belly button when we meet you for an evaluation of abdominal pain. We may think that that's the actual cause of your abdominal pain, but we're going to rely on a good surgeon to help us to fix that. We also diagnose hiatal hernias when we do endoscopy. We have other videos that cover that. And so yes, we are able to diagnose hiatal hernias, but we rely on surgeons to actually fix these. Here's a good question to follow up on the last. Can a gastroenterologist perform surgery? This used to be a simple no. However, endoscopic technology is now allowing us to border on surgery. We can use endoscopic techniques within the esophagus and the stomach that were not previously possible to fix things in ways comparable to surgery. For example, we can now actually perform bariatric procedures through endoscopy. And while these originally started as procedures that were only intended for people who couldn't tolerate a surgery, they may in the future become the preferred first line. Can a gastroenterologist prescribe weight loss pills? Some GI doctors focus on weight loss, like those that I mentioned who perform bariatric endoscopy. And they may prescribe weight loss medications in their clinic, but they often work in tandem with endocrinologists as the primary prescriber of these medications. Can a gastroenterologist remove hemorrhoids? GI doctors commonly find hemorrhoids at the time of colonoscopy. In patients who already know that they have them, will ask me for a twofer at the time of their screening colonoscopy. But when a GI doctor performs hemorrhoid removal, it's done as a separate procedure. It's often very painful, and I personally don't perform it. I defer it to a surgeon. Did you find the answers to these questions helpful? Do you have more? Leave them in the comments below. We'll answer those along with others in an upcoming video, so subscribe to be on the lookout for that. Thank you for watching and be safe.